Hi, this is Dr. Pritesh from Levels Physical Therapy and Chiropractic. Today I'm going to show you how to release your levator scapulae muscle and your rhomboid muscle. So these muscles are situated at the back of the shoulder blade. It's just between the spine and between the blades. So you'll find these areas that hurt the most, and you'll often find that it's hard to reach to these spots. You can't really get there. So this is why the Lumacane helps us to get to these nagging spots, and it's going to be good. So let's start. So I would prefer to do this in standing, unlike sitting, because there is a tendency to slouch in sitting and you can't really generate the force. So identify the spots right between the shoulder blade right here and the spine. You're going to come in this area here that's marked in this region. And often this area is also a common source of neck pain that goes all the way up to the base of your skull and maybe the head at times. So you'll also feel it the moment you touch it, that it is a bit tender. So look out for those spots. So let's begin with the levator scap that begins at the tip of my shoulder blade and goes all the way up here. Now keep in mind, we don't have to release anything here. This is advanced level, so I would not recommend anybody at home using the Lumacane for this area because it has a lot of vital structures, and it's only for advanced level clients who can understand how to use this. Yeah. So now that I've identified my spot right here, I'm going to press it down in this oblique fashion, and I'm going to tilt my neck up and down. I'm going to tilt my neck up and down. Now the reason we are moving is so that the muscle moves along and it gets released automatically. And relax. So let's show you again. You're going to use the Lumacane in an oblique fashion. I'm going to go down in this direction, right along over here, and I'm going to press it this way. So if you see, I'm trying to get this ahead in this kind of a motion and not just down and not just ahead. It's oblique, right? So we're going to identify again. I'm going to generate the force, and wow, it's going to really start hurting you. And make sure you're hooked onto it before you start moving your neck, because I don't want you to move with this moving on and off. So generate the force, keep it locked in, and look up and look down and look up and look down. You can do this approximately 10 to 15 times before moving on to the next spot, going a little higher up, and then again going up and going down. Now once I'm done with 10 counts here, I'm going to slide a little lower and I'm going to pull this way. I'm going to pull ahead and then repeat the same drill for 3 sets of 10 counts, so that essentially makes it 30 seconds of release at each spot. Just this way. And make sure the motion is very easy and slow. I don't want you to rush into it. And yes, don't forget to breathe and relax. So, and then you can go on to the next side, and let's say I have to release the right side now. I'll change hands. I'll lock it in this way, and again I'm going to pull downwards, and you're going to feel it hurt a lot, and just move in the same fashion. You go up and down, and let's say 10's done over here, and then I come up higher, and then I do it in this fashion. Now if you're having any fabrics that's too slippery, or it's something like satin or velvet, there you have the tendency for it to just slip and just slide off in this fashion. Now that's going to be dangerous. So my advice would be to wear something that is not slippery, or maybe just take the top off or the t-shirt off and go directly on your skin, which is by far more effective actually.